Hello, let's talk top 10 reasons why people die in the United States. Most common is heart disease, and reason for heart disease, high blood pressure. So, heart disease, make sure you're taking care of your blood pressure. Second is cancer. Most common cancer is lung cancer. So, don't smoke at age of 50. We screen for a CT lung cancer screening, which is study to look for those lung nodules. Second is gender specific cancers. So, you have the breast in females, which we now screen at age of 40. And for males, the prostate cancer at 55. The PSA not being the best screening tool, but it's definitely something which can be offered to patients. Third is, of course, colon. It's preventable cancer. And at 45, you start screening for these colon cancers. Sigmoidoscopies, colonoscopies are definitely the way to go to prevent the cancer, 600,000 deaths every year. Third is accidents. Most common reason for accidents, of course, is driving fast. So please drive slowly. Marijuana can cause, just like alcohol, the reflexes to go bad, which causes accidents. So don't drink and drive, don't do marijuana and drive. Then drugs, narcotics, they cause respiratory depression. So be very careful about having the Narcan in handy. It's very important. It's the unintentional injury. So being sad, smoking marijuana, alcohol, and drugs. When people are sad, they intentionally want to harm themselves. So it's a very good question. Are you sad? And if they are sad, ask the other question that do you enjoy the things which you used to enjoy before? Because anhedonia, or that's okay, if you're not enjoying your work or enjoying the things you used to enjoy, that's a good PHQ 2 questions. And the ninth question on the PHQ 9 is actually suicidal thoughts or hurting yourself, which used to be intentional injuries, just like third being the accidents. Asthma and COPD, which are the fourth most common reason why people used to die. Asthma, COPD, both are inflammatory reactive disease. It used to be flu and pneumonia. Now, flu and pneumonia, COVID vaccines are there. So that used to be the fourth and the eighth most common reason why people die in the United States. COVID is there. Fifth and sixth used to be stroke and dementia, which are still there. So if you have forgetfulness, dementia in the family. Seventh is diabetes, why people die. So every year an eye exam. So A, B, C, D, E. Know your A1C. Keep your blood pressures and the sugars both 130, 80. For sugars, blood pressures 130, 80. Cholesterol, be on a statin like I discussed. Have a dietitian see you. Have an eye exam every year. Have a foot exam every year. So A1C, blood pressure, cholesterol pill, dietitian, eye exam, foot exam, having that glucose monitor with you, bringing your A1C down. That's the seventh most common reason. Ninth is kidney disease. So most common reason for kidney disease, of course, diabetes. So if you keep your diabetes and blood pressures better, 70% of the kidney disease get better, which is managing your diabetes and blood pressure. And avoid Advils, Aleve, ibuprofens, naproxens, those kind of things are bad. And liver disease are one of the common reasons now in the top 10. Wasn't there, just like COVID wasn't there. So getting protection from hepatitis A, B is better in avoiding metabolic disease like fatty